Hello, welcome to News 9 Facebook Live with me, Surat Suresh. Well, one of the main impacts of COVID-19 across the world has been with respect to the kind of mental health issues that people are developing. Yes, even the government of Karnataka, for that matter, they had made several arrangements for the same. They had even said that they will be catering to these problems. They will also be interacting and counseling the migrant workers, the people, the healthcare workers, all of them, just to ensure that they do not come under the ambit of these mental health issues as well. For the same reason, now we have seen that several data has already come forward from the health department itself. 8,000 patients or people were counseled and they were interacting with all of them, the medical health workers, even they had to undergo counseling as well. Well, the data that we have obtained, 8,000 people were counseled, and the counseling session was almost 4.8 lakh counseling sessions have taken place, out of which migrant workers stand first, where over 71,002 migrant workers were actually counseled and they were treated for the same. They were even administered medicine. And after that come the medical health workers, the frontline workers as well, where over 12,477 people have actually been administered medicine as well. And then come the other migrant workers who also provided treatment. So to understand all of this, what was the main concerns from the people and what were the main problems that they had to undergo? To speak about all of this, we have with us the Deputy Director for Mental Health in the Department of Health and Family Welfare Department, that is Dr. Rajni P. Many thanks for joining us, ma'am. Firstly, we have seen the kind of problems that people have been going through with respect to mental health issues, and even in Karnataka, for that matter, Karnataka government had said that they'll be counseling as many people as possible. So what was the result like? How many people did you actually counsel, and what are the problems that they had reported during the counseling sessions?
Yeah, basically, from Health and Family Welfare Department, Government of Karnataka, even before the first case was reported, like to be precise, in the March 9th. So from March 7th itself, one decision was taken that along with the physical health of those tested positive, those in isolation, quarantine, and then everybody, we have to provide the mental health support also. Absolutely. So because in the pandemic, it is very known that we are bound to go through a lot of distress. And it is very, new situation around the world. So we have team of psychiatrists, psychologists, social worker, nurses around across the state in all the districts in Karnataka. So from March till now, we have given around 4.9 lakh tele-counseling sessions. So that means many people would have, received counseling multiple times. These Absolutely. Are not number of persons. These are number of tele-counseling sessions. In that, around 8,000 were put on treatment. That's all. Okay?
Okay.
So what I want to tell you is not everyone who is COVID positive or whether healthcare workers, healthcare warriors, doctors, migrants and, those in isolation, quarantine, not everyone is in distress. So many have coped very well with they have sailed through successfully. And of course, some of them have reported a lot of anxiety, low mood, and then increased health anxiety, and then substance withdrawal symptoms, that is withdrawal from alcohol, cigarettes, cannabis.
Now, what was the main concern of all of these people? Because migrant workers accounted to most of the counseling sessions were actually for migrant workers who were stuck here, who were stranded in Karnataka as well. They wanted to go back to their native. So most of them would have been here. So what are the main concerns?
So you are specifically asking about the migrant workers, right?
Yeah.
So basically, I want to tell you, because we have data of all the people, migrant workers were one chunk. So most of it, if you see isolation, quarantine, that is the number of persons are more. And among them, the majority of the symptoms, what they expressed is anxiety, low mood, and then the substance withdrawal problems, fear of getting infected, and fear of infecting their kith and kin. And specifically, in particular, the migrant workers, their worry was about the logistics issues. So will I be able to go back to my place? about the food, and then the water, hot water problems, and
Correct.
then the washrooms and other issues. Though these sound very very simple, it was quite difficult for them. Like, of course, the groceries were provided, and some people were reporting like the groceries are getting over. We have started in that apprehension whether they supply again or not. We are having food only once a day. We're feeding our children also little less than what is required. So all these kinds. And then what was outstanding was the stigma and discrimination. They were very afraid.
Correct.
Like, if I become
In
COVID
the
positive.
beginning, if we all remember, COVID-19, if you were infected with it, it was more like a
Yeah.
stigma, and
Yeah.
people are scared to even
Even
come
now,
forward.
even today, stigma and discrimination is a very big issue that we are facing everywhere. So if you
Correct.
see a person is cured or whatever, got infected, recovered, and many of the family members are like, they are treating as if it is like a time bomb ticking in the house.
Absolutely.
So these are all the issues that they were facing, and we have been encountering during our counseling session.
Absolutely. Now, one thing, if at all the treatment has to be given, how are they administered
Yeah.
treatment as well? What kind of
Yeah.
treatment? Was it just
Yeah.
counseling, or will they have to take few medicines as well?
Yeah, majority of them needed supportive psychotherapy. So if I have to give you an example, for example, I was telecounseling. I was
Okay.
counseling through telephone one of the clients who was COVID positive in the initial days itself. He was running fever. He had lot of jet lag. He was not able to sleep in the night, and he was telling like, it's really hard. I'm not able to do anything. My physical health is going on. He was very anxious, and then was not sleeping the whole night, right? So at this point of time, through the treating therapist, we would give prescription for an anti-anxiety, antidepressant medicines, and that would be started along with other medicines. So to our surprise, he, very nicely he started improving. From fourth day, he started doing, minimal exercise there, started taking balanced food, started doing relaxation exercises, what I suggested, and beautifully he improved, and he was, first to go out of the, discharge procedure. So, yeah.
Yeah.
This is one of the things. And one more person who was facing, stigma, to give you an example. Like this person was alone here. She had come from other state. So
Okay.
actually she went abroad for an assignment, came back, COVID tested positive, and she was very altruistic and she wanted to protect. Out of the community concern, she had put her status in the Facebook in the initial days, so that I have been tested COVID positive. If anybody has come in contact with me, please be watchful about
Yeah.
your fever, cough, whatever it is. So of course many of them appreciated her, but few of them like called her like, you are dangerous, you have to be put behind bars. So this kind of comments also she had got. So she
Okay.
was sharing this with me, and she felt very bad about it. And later what happened, her apartment owner told, you are not coming back to our apartment. And then actually I had to take the apartment owner's number and then counsel the apartment owner also. And of course everything went on very well. So this amount of interventions, it's not only the mental health issues, other logistics issues and other things also. We have been tailoring our counseling.
Well, that is a very good point that you
their
mentioned
needs.
regarding,
Yeah.
the other logistical issues as well, which people
Yeah.
will be facing. Because
Yeah.
if we remember, even
Yeah.
during that incident which took place in Padarayanpura, I remember that the BBMP as well as the health department said that we will be counseling them as well, because probably
Correct.
they are in such a state where they do not know what they're doing. Probably it is a
Correct.
stigma again which is affecting them,
Yeah.
and they feel
Yeah.
that they are being targeted. So how did you tackle that? Because I remember that the counselors went every day. They were asking for tobacco, they were asking for alcohol. So how did you tackle that situation as well? Because
See,
that
most
was
of
a
it,
crucial
what
point.
we have been following is the tele-counseling method
Okay.
through the mental health professionals.
Okay.
So what we would tell them is, be little altruistic. That is, you have to think about others and the bigger cause, work for a bigger cause. Have a, daily routine. Do exercise regularly. Have balanced diet which will boost your immunity. And then be connected with people. Talk and share your problems. See and help each other. And then support each other. So these are, and seek help when in need. So all these things, and this actually helped everybody, right? Most of them. Yeah.
Now, lastly, if I have to ask you, probably now people have started to accept COVID-19 as an infection and nothing more than that. So probably now people are open to it. They are more accepting at this point. But at the same
Most
time,
of them.
a lot of them will be facing, the mental health issue even now for that matter. So will this continue for a longer time? What kind of medications will be given? How can they approach the Department of Health and Family Welfare if at all they need?
Yeah, some key suggestions what I would suggest is never discriminate and the stigma. What are the problems of stigma is people will not seek help when in need. They will start hiding their symptoms, which may be detrimental to them. So key messages would be support each other, have buddy groups among yourself like neighbors, apartments, even in apartments and even any place, like even if it is a tribal place, and even healthcare workers, doctors and police. So you have buddy groups so that, if I become positive, you can help me, you can support me. If you have some issue, you are in isolation, quarantine, or you have some other issue, I will be supporting you. So this is one key message. And other thing is seek help when in need. That, for example, if you are very anxious, if you have low mood, if you get suicidal thoughts, if you have alcohol and substance use withdrawal symptoms, do seek help from a mental health professional nearer to you. And you can also call 104 and press 4, wherein we have given the telephone numbers of all the district-wise psychiatrists. So if you don't want to directly go to a mental health professional, you can call 104 and press 4 and seek help through that also. So many of them also have a stigma of going to a psychiatrist. Am I mad? Why should I meet a psychiatrist? So it is not like that. You see, to make it very simple, so who is not very happy to go to a beautician because your physical health improves, right?
Correct.
So going to a psychiatrist or mental health professional is also like meeting a beautician, getting some tips to improve your mental health. So your physical, mental health is very, very important. Start talking about your mental health issues also.
Absolutely.
Yeah.
Well, many thanks for joining us, Dr. Rajni, with all of that information. Well, the Deputy Director for Mental Health, giving us information on how you can go ahead and reach out, whether or not you are COVID patient or not, if at all you have these tendencies of, suicidal tendencies, or if you are feeling low or you feel like everything is going out of place, then probably it is not wrong to reach out to the, professionals. It is not wrong to reach out to the psychiatrists as well, because they are the ones who are there. They are the ones who will be helping you out as well. A number which has been given 104, and then you can press 4, wherein the health department officials itself will be directing you to the healthcare workers or the psychiatrists. You can interact with them. You can tell them what kind of problems. This is the alternative which has been given by the government of Karnataka itself. Now, apart from that, you yourself, if at all you feel or someone who feels or has such thoughts, you can, ensure that they reach out to medical professionals. Do not become a medical professional yourself. You can support them, but at the end of the day, if they have to be treated, if they have to be diagnosed, if they have to be spoken to and a treatment has to be given, it has to be a medical professional itself. So do ensure that you reach out to the proper medical professional, and at the same time, do not go ahead and discard the thoughts that you have. Do not neglect this particular issue, because a lot of people actually feel all of these problems, and probably the stigma which is there in the society, probably this will continue for some more time. COVID-19 probably is here to stay. But at the same time, if at all you have any of these problems, mental health issues, or any of the mental trauma that you're going through, do reach out to the professionals and ensure that you have your health in your control. Well, if you have liked this interaction, do hit the like button, share, and subscribe to News9 Digital. And we'll meet you next time in another interaction as well. Many thanks for joining us.